Hello, I am Dr. P.C. Raka, nowadays traveling to US. I am a consultant physician and my concern is, in this particular video, the change in climate and adverse effect on health and diseases. This subject is relevant to almost every country on the globe. It is nothing like in US or nothing like in India, nothing like in Europe. But being nowadays I am traveling in US, what I used to say that in California there are earthquakes, there is flooding. In New York and above, there is a heavy snowfall. At Key West, at 0 Mile area, there is a rise in the sea level. What exactly it is? It is all because of the exploitation of the nature. The change of season is a rule of nature. But when the nature is heavily or very badly exploited, it leads to melting of the glaciers, finally leading to rise in sea level. Change in temperature leads to many times draught, sometimes flooding, sometimes diseases related to high temperature. In the environment, allergens pattern changes. There is an increase in the incidence of diseases related to allergy like asthma, like bronchitis. There is a change in the nature of the vector which are responsible for the diseases in the tropical countries. With the fall in the temperature, they move towards the temperature rise area. So some of the diseases which are vector borne, which I will discuss in my this video, are changing their pattern. These drastic changes in the climate lead to disease like malaria, dengue, hantavirus, encephalitis, Rift Valley fever, chikungunya. These flooded area or El Nino effect leads to injuries, leads to mental health issues, leads to casualties. They force the community to mobilize from one area to another for their safety. So there is a malnutrition, there is a scarcity of the food, there is a scarcity of potable water, water get contaminated, leading to waterborne diseases. If this is the situation, then what exactly we are doing, it is all because of that there is a big emission of the greenhouse gases like carbon dioxide, like nitrous monoxide, like ethane. These all in environment leading to rise in temperature. The burning of the fossils add these gases in the environment. There is a zoonotic change, as I had told you, leads to vector-borne diseases. More of like malaria, like chikungunya, we have seen the pattern of this disease is changing day to day. There is a more swine flu when there is a fall in the temperature. The incidence of influenza increases. So many diseases can be attributed to the change of climate. There is a gradual increase in the global baseline temperature. The night temperature is more changing than the daytime temperature. The diseases which used to occur in the tropical areas are now shifting, and the transmission barrier is gradually failing of late due to global warming. The WHO estimates that there are approximately 4 billion cases of diarrhea each year and 2.2 million deaths. This is all because of the flood water, the water get contaminated, the food get contaminated, it is being consumed and leading to gastroenteritis, leading to diarrhea, leading to cholera. Hurricanes and the seawater contamination leads to high level of chloride, which is not good for drinking purposes. One can understand that how badly it has affected so many areas. The consumption of some of the fishes lead to severe hemorrhagic fever in Seattle, in Alaska area. So these are some of the examples which we can very well understand that this type of examples can be replicated in any part of the world. There are other examples where plague, hantavirus infection increased because of NSO, El Nino South Oscillation, where in every 5 years there is a change in the temperature and such type of epidemics used to happen. So, due to increasing temperature, Lyme's disease, babinosis, and anaplasmosis in New England has proved itself that we have to take care of our environment. Swine flu, which is the orthomyxovirus family, affecting all ages. Epidemics occurs in the rainy season. The first epidemic occurred in Mexico in 2009, and India has also faced the increased incidence of swine flu. Glacial meltings resulting into change in the pressure in the earth. The water goes to the earth. There is a seismic effect and leading to earthquakes. The best example after so many studies is that of California. Cyclones and hurricanes many a times create a problem of habitats. The deforestation lead to the contact of wild animals with human beings and pet animals, leading to so many diseases which are related to the wild animals. Migration of the population lead to malnutrition, lead to economic crisis, lead to availability of safe water. All this leads to one or the another disease related to human beings. What basically we can do, how to mitigate the risk of the diseases related to climate change. Climate change linked to cycle of infectious agents by ecological process causing seasonal fluctuations. We should have big survey. We should have database what is happening because of the climate change. We should try to improve the quality of the air so that allergic diseases, the diseases related to bad air, the polluted air, to be taken care of. We have seen what is happening every year in the Delhi during winters. What is happening every year after the crackers being burned on the festivals. Not only in India, in other parts of the world also. We should concentrate upon the public health, the involvement of the public health specialist, involvement of the environment specialist in the health sector is must now. We should train our doctors that these are some of the emergencies can happen at any point of time, and we should be ready for the diseases related to climate change. Climate change and diseases should be the part of the curriculum of medical education also, so that every medical practitioner, every healthcare worker is aware of what to do and when to do, how to have an effective control over such type of epidemics. Thank you very much.